Good afternoon, everyone, and thank you for joining our session today on the basics of VWD. Hopefully you had an opportunity to join our pre-con where we had some really great information there, not just what's happening here in the United States, but also around the world. And also just a quick reminder that we do have our VWD reception, so make sure you look out for that and join us, where we're going to have some really beautiful live music and also an opportunity to connect with each other. It is such a pleasure to welcome one of my favorite folks that helps us out here at NHF, Dr. Daisy Cortez, such an incredible human being and really passionate about the work. And today she's taking time out to give us a beginning dialogue of the basics of VWD that we all need to know about, and further research in terms of where we're going and where we are at this point. So Daisy, thank you so much for being part of our conference. And remember, everybody, if you have any questions, you can use the chat box at the bottom to ask any questions. And then if we don't get to them, we'll make sure that we'll be able to email you some of the answers. So without further ado, I present to you Dr. Daisy Cortez.
Thank you, John, for that very warm introduction. Thank you guys for allowing me to be here, and a great big thanks to NHF for allowing me to be a part of this. Very excited to be here with you guys to talk about von Willebrand disease. My name is Dr. Daisy Cortez. I come from the Hemostasis and Thrombosis Center of Nevada. I am very excited to give this talk to you guys, and of course, any questions or concerns that you have, I'm definitely more than happy to answer. So getting the most from this section, of course, asking a follow-up question box for responses at a later time. Be sure that you give additional feedback at the end by filling out the evaluation. And all presentations are recorded and will be available to watch online. So you can always refer back if you have any clarifications or any concerns that you may have at that time. I do have some disclosures. I'm part of the advisory board for Genentech, Octapharma, Takeda, and Bayer, and I'm on the speaker bureau for Octapharma. So what is von Willebrand disease? Well, it tends to be the most common bleeding disorder. It's basically picked up in 1% by lab testing, so about 1 in 500 people are symptomatic. It affects males equally as females, unlike hemophilia where males tend to be more affected, although females can show signs, but von Willebrand is equally distributed, and it is equally distributed along all races. So this is just a quick picture of kind of what happens anytime we get a cut or an injury that causes our blood vessel to bleed. So what happens is at the very bottom, you'll see the endothelial cells, and they break, which causes us to bleed. Von Willebrand gets secreted out of these cells, and you see these nice large green kind of stacks. It gets released into the circulation, and it attracts the attention of what we call platelets. So the platelets are the cells that actually kind of stick upon each other and form this nice clot, along with a whole other process of coagulation. So it works in sync with each other. And once you're able to release that von Willebrand, you activate these platelets. It triggers all the platelets to become sticky and stick to one another, and again form a nice clot at the very bottom so that we stop bleeding and we're starting to begin the healing process. So we see that the von Willebrand factor binds to the collagen and binds to the platelets, which becomes important when we look at testing. So the signs and symptoms of von Willebrand disease typically tend to be more mucosal type bleeding. So what does that mean? So you tend to see a lot more nosebleeds or epistaxis. You see a lot of bruising. So typically we normally bruise just because we bump into a table or a chair or stub our toe. But you'll notice with von Willebrand, you may have easy bruising just with a simple graze, or just bruises that you don't even know how to answer how they got there, or even in areas that you typically don't expect to see a bruise at. You can also have oral bleeding, so any gum bleeding, especially after any dental treatments or any dental extractions. You've noticed that it bleeds for a very, very long time, or even just biting the inside of your cheek, which we commonly do. And you typically stop bleeding within a couple seconds or up to a minute, but this just keeps oozing and you can keep tasting the blood in your mouth. Menorrhagia in females, so having very heavy periods. And this can range from the amount of pads or tampons that you're changing throughout a day, versus how many days it's actually lasting. So there's some females who have very heavy periods, although they're very short duration, so 5-7 days, which is typical, but the amount of pads that they're going through is a lot more than what's expected for normal. Or you've had females that actually have a period for more than the 7 days, about 2 weeks, 3 weeks even, with maybe a week break in between. And so again, there's some variation to that, but again, it's very atypical from the norm. You may have postpartum bleeding in females of childbearing age. You also have type 3 von Willebrand's disease may have mucocutaneous bleeding, but they also have this hemophilia-like bleeding. And I'll get into a little bit more about what type 3 is, but basically it's the complete absence of von Willebrand's, which is why you're more prone to having different kinds of bleeding. You could have excessive bleeding with trauma, which again, this is why it's important to know of your diagnosis of von Willebrand, because if anything were to happen, then you need to be treated appropriately to help you stop any internal bleeding. Again, bleeding after any dental extractions, any surgical bleeds. So after surgery, you may have some complications or had a complication where you could have needed a blood transfusion or you didn't stop bleeding. Most commonly in the pediatric population, for example, after a tonsillectomy, which is already a very bloody post-op, it tends to be more duration, so it lasts a lot longer. You can't get the bleeding to be under control. And bleeding from minor cuts or abrasions. So even just a simple cut or just falling and scraping your knee, you notice that you're oozing for quite a long time and it takes a while for it to stop. So we know that von Willebrand's levels can be modified by many coexisting conditions. And so this can actually affect what your testing results are, which again will become important when we talk about it in a little bit. But basically these conditions that are associated with a higher von Willebrand level is age. As we get older, of course, everything kind of starts to deteriorate a little bit, unfortunately, and you falsely release this von Willebrand factor. So when you're testing, it can actually cause this false normal. Any acute or chronic inflammation, so if you're currently ill or stressed or anything like that, that could affect your levels. Diabetes is also known to do that. Malignancy, so any cancers. Any pregnancy, oral contraceptive, or estrogens may also falsely elevate von Willebrand's, which makes it a very important point in testing, and I'll touch upon that later as well. Any stress or exercise. So if you literally just ran around the block, like to get to your appointment or anything, and now you're getting checked, you actually may have just brought up your levels incidentally by doing that. And hyperthyroidism, which is the condition of the thyroid. It's overactive, and so that again may cause a false von Willebrand's level as well. So there are some conditions that are associated with the reduced von Willebrand factor level. One of those being hypothyroid, so the opposite of the hyper. So your thyroid isn't working as well, so it actually can reduce your von Willebrand factor. And it's been shown that blood type O have about 25 to 30% lower von Willebrand factor levels than other blood types, but it may not be symptomatic for these patients. So that's just another clue for those that have been diagnosed with von Willebrand to just check your blood type also to see if it could be related to the fact that your blood type O just reduces you a bit more. So these are suggested questions for screening that I usually like to have the providers utilize, like your PCP or anyone who is trying to get a good history, or when you come to the HTC, we'll be asking these questions. So typically, if you've had a blood relative who has a bleeding disorder, such as von Willebrand or hemophilia, if you've ever had any prolonged bleeding from any trivial wounds that last more than 15 minutes, or that reoccur spontaneously after during the 7 days after you got the wound. If you've ever had any heavy or prolonged or any recurrent bleeding after any surgical procedures, so such as tonsillectomies, so it's important to get that history, especially if you're a grown-up, to know if any of that happened when you were a child. If you've ever had any bruising with minimal or no apparent trauma, especially if you could feel a lump under the bruise. So if you feel that bump, it's kind of a significant bruise. Typically, bruises should be pretty flat. And if you've ever had any spontaneous nosebleeds that required more than the 10 minutes to stop, or if you needed medical attention, had to go to the ER or urgent care because the nosebleed wouldn't stop. If you've ever had any heavy prolonged or heavy bleeding after any dental extractions that required medical attention also. If you've ever noticed any blood in your stool, which is an important one, especially as we get older. Typically, if you've had any history of any ulcers or polyps, that could be the cause, but sometimes that can cause even more bleeding. So again, it's important to follow up with that and make sure you're getting treated appropriately. If anyone's ever had anemia requiring any blood transfusions, which that's a big one because people don't realize that they may be losing blood and then internally and just were told that they had anemia without a further workup and had a blood transfusion. And for women, if they've ever noticed any heavy menses with presence of clots that are greater than 1 inch in diameter, or again, changing a pad or tampon more than hourly, or that the menorrhagia is so severe that you've actually had severe anemia and a low iron level, so you needed to be on iron treatments. So there are many subtypes of von Willebrand disease. So there's the quantitative, which are the type 1 and type 3, so it goes with the quantity, the amount, and then qualitative, which is type 2, A, B, M, and N. And that just means you may have von Willebrand present, but it just doesn't work as well. So with the quantitative deficiencies with type 1, which is the most common one, we see a partial quantitative deficiency of von Willebrand. So you may have some von Willebrand there, it's just not at its normal level. With type 3, you have a complete absence of von Willebrand, and that's why you can typically see multiple types of bleed, and they have that hemophilia-like picture where they actually have more joint bleeding or more muscle bleeds versus your typical von Willebrand, which is more mucocutaneous. The qualitative deficiencies of von Willebrand, type 2A, I like to think of it in kind of acronyms of absent multimers. So that means that basically you have a decreased platelet-dependent function. So remember, von Willebrand attracts the platelets so that they trigger the clot. And when you have that decreased function, you're not able to really bind very well because you don't have those high and intermediate von Willebrand multimers. So the stacks that we looked at, those green stacks, are important, and we measured the length of those also. Type 2B is bound to platelets. So you have an increased affinity for platelet GP1B, which is the little anchor that von Willebrand likes to attach to. Type 2M, which I like to say is mad at platelets because you have a decreased platelet-dependent function and you have normal multimers. But again, it doesn't want to bind to the platelet, so you are not able to trigger that clotting effect. And then type 2N, not having it with 8. So von Willebrand disease is von Willebrand factor is actually carried on factor 8. And if you don't have that affinity, von Willebrand and factor 8 actually get cleared out of your bloodstream pretty quick. So then you're not able to hold on to that if you need it in the case of a bleed or an injury. So this is basically the types of treatments that we use in the different types. So with type 1, sure you may have heard of Ddavp. That is a hormonal derivative that stimulates vasopressin, which actually causes your endothelial cells to release the von Willebrand as needed. An antifibrinolytic such as Amicar or tranexamic acid, and I'll discuss a little bit more about these as we go along, or topical. And I like to show this slide just because with the different types of bleeds, we may have different options for treatment. So when you have minor surgery like a dental extraction or something like that, we could just simply use Ddavp and then we'd have you use your Amicar for X amount of time. If you were to have major surgery, then at that point you need to replace the factor that you're missing and use an antifibrinolytic. So the treatment options that we have, so you have increased circulating von Willebrand factor by using desmopressin or replacement with plasma-derived von Willebrand concentrate. You can inhibit fibrinolysis, which basically means you use a medication that doesn't break down the clot. Our body naturally clots and it hates to keep those clots around, so it uses different proteins to break those clots. What antifibrinolytics do, like Amicar and tranexamic acid, is basically inhibit that clot to be broken down more. So anytime we tell you to use your Amicar, it's more in conjunction with another type of medication so that you are treating the bleed and holding onto that clot for a little bit longer so that we make sure you don't bleed more. Hormonal therapy is a big one, especially in our females. It is effective for menorrhagia management. Again, estrogen causes that increased von Willebrand factor and factor 8. And typically, especially with our females when they're pregnant, because of that higher level of estrogen, they may notice that they don't have any bleeding issues during the course of the pregnancy. There's a reduced blood flow to the endometrium when you use hormonal therapy. So again, that helps minimize the amount of menorrhagia you may experience. It does take time for that to take effect. Because again, now you're introducing these hormones, your body has to actually adjust to that. So that is very time sensitive in the sense that it can range anywhere for a couple of months, even up to a year, before you start seeing more of a normalized cycle. And then there's topical therapies. So again, antifibrinolytics for any oral bleeding, topical thrombin for oral or nose bleeding, and cellulose or collage embedded gauze, which is what we use usually in the clinic or in the hospital setting. So Ddavp and desmopressin, we typically reserve that for ages between 3 to 55 years of age. And that's typically because children younger than 3 may have a diminished response, or because due to the symptoms of hyponatremia, which I'll talk about in a little bit, we typically don't like to use in adults that are older, just since they're not able to regulate their electrolytes just as well. We don't like to use this for more than 2 consecutive days, and that typically goes with the fact that the side effects that go with it, especially the hyponatremia, and you basically are on a fluid restriction, so we don't want to keep you dehydrated for more than those 2 days. You should limit your fluid intake for 24 hours following Ddavp. So again, we typically give the guidelines depending on age, weight, and things like that. But in adults, that's no more than 2 liters in that 24-hour time period. We typically avoid this medication in patients that have an increased risk of hyponatremia or seizures. So if you already have a low sodium in your body, or you have any kidney issues that may not regulate sodium very well, then we typically stay away from this kind of medicine. Other side effects that we see, you can have flushing. Headache tends to be the most common. I've had patients who have had some nausea, even some vomiting with it, and abdominal pain, and hypotension, which is low blood pressure. So again, this is something that we first test to see if you actually have a response. When you come to clinic, we'll do a baseline lab level of your von Willebrand factor, and then we'll give you your Ddavp, and then we'll check in a few hours to see how much of a response that Ddavp was. Because if it substantially brings up your von Willebrand factor, then yes, it will work for you, and it's easier to kind of carry around if you use the nasal form. But if you don't respond, then there's no point in using it, so we would just go to factor. Antifibrinolytics. So they're used as adjuncts for your mucocutaneous bleeds. So we have aminocapric acid, so it's available in liquid, which I actually like to use for oral bleeding as well as any GI bleeding, since it coats the GI system much better. And we have tablets as well, but they are a little bit on the bigger side, so I think a lot of patients prefer the oral liquid, although they say the taste is not the greatest. And we typically dose according by weight, and of course if you max out at the weight, we max at 3,000 milligrams. So we do it every 6 hours for 5 days, or as needed for the bleeding, and of course you'll refer to what your provider is telling you to use it for. And tranexamic acid. This is indicated more for adult use for menorrhagia. It's better tolerated with less side effects, and we dose it about 1,300 milligrams, so two capsules 3 times a day for 5 days as needed for any menorrhagia. The common side effects that we see with these kind of medications: abdominal pain, you can have some nausea, dizziness, and headaches, but I haven't had too many complaints from my patients. And they actually see a good effect with the Ddavp for the females. Von Willebrand replacement factor. So there's multiple types of factor that we use, but the dosing is generally about the same. We look at the ricitin cofactors. So it's about 50 to 75 of the ricitin cofactor units per kilogram. So again, this is weight dependent. It depends on the product, the type of bleed, and things like that. So your provider really looks at the picture and what happens to be able to dose you appropriately. Different brands have different von Willebrand factor to the factor VIII ratios, so that's kind of important to know from a provider standpoint. In urgent traumas or emergencies, patients may need to get cryoprecipitate, which is a blood product that contains von Willebrand factor, but again, not used regularly. It's just really used for emergencies where the von Willebrand factors concentrates are not available, or again, it's a trauma and it just needs to be treated right away. There's about 80 to 100 units of factor VIII and von Willebrand antigen, and activity in about a 15 ml pack. So again, you would definitely use replacement factor with the appropriate dosing. And when you use cryoprecipitate, you're not getting that same amount that you would need just with the straight factor that we would prescribe. So there are additional non-factor adjunctive therapies. So topical thrombin, it's a prothrombin is activated by a thromboplastin in the coagulation cascade, and I know it gets very hectic to look at, but this is used to kind of help stop any bleeding, especially we like it for nosebleeds. There's a common product called FlowSeal, which you may or may not be familiar with, but thrombin is mixed with sterile hemostatic matrix. And again, it's nice because it actually goes quickly and acts at the site of bleeding, so it can help stop that much quicker. Other products are known as Quick Clot, Nasal Cease, and Wound Seal. Other non-medical uses of topical thrombin, like salt pork, which you can buy at any deli, and they have it refrigerated somewhere in the back typically. But if you ask for salt pork, you would actually just cut it off and actually tie it up, and you can stick it in the freezer, and anytime you have a nosebleed or anything like that, you would just take that from the freezer and put it up your nose. And it helps for people who live in more rural areas who may not always have access to their medications, or there may be a delay in actually getting it. Black tea bags, the tannic acid in those teas actually do help stop bleeding as well. So if you've had an oral bleed, you steep the tea bag for 5 minutes in hot water. Obviously, you let it cool down, and then you apply the tea bag directly. So I just had this on a patient about a week ago who was having a tooth break through her gum, and so we just applied that, and it worked for her. Arnica montana is a type of herb that's used to help ease with bruising. I haven't used that on anyone personally, but that's just something that's out there. And again, if it's something that you're interested in and more of a naturopathic, then you can definitely ask your provider about that. And of course, the go-to that we always use is ice. Ice is free, it's cheap, and you can get it from anywhere. It's the easiest thing to kind of help restrict any bleed. So what happens is ice causes our veins to what we call vasoconstrict, so they get really tight. So it kind of stops that bleed right away. So for our patients with nose bleeding or anything like that, typically we'll say apply an ice pack to your head, or even for pediatrics, our favorite, suck on a popsicle. As the ice touches that hard palate, so the hard part on the top of your mouth, it actually causes those veins in your nose to constrict, and it helps ease the bleeding. So you get a tasty treat and you get treatment at the same time. So this is why I like pediatrics. So the biggest thing for our patients that we've realized, a lot of the time people kind of dismiss von Willebrand disease. As I had alluded to earlier, a lot of the time our von Willebrand factor levels can increase with any of the mentioned issues. So of course with age, any chronic illnesses or diseases, or any stress, which we all normally go through. And so when people see these normal results, even though you had a diagnosis of von Willebrand's before, they'll say, oh, you don't have it anymore. Well, that's not necessarily the case. You'll always have von Willebrand's. It just depends, again, on when you were getting tested. So that's why it's important when you are getting tested. First of all, if you're a female, we typically like it to test around your second or third day of your period. And the reason why is because your estrogen level is at its lowest. So we try to get the most accurate laboratory value that we can. We're fortunate in the sense that we've come a long way testing-wise, that we can offer genetics and things like that. But again, it depends on your insurance and it depends at the center. Our center can provide genetic testing, but some insurance companies have you pay an out-of-pocket, which with genetic testing, it is a little bit on the pricier side, so that's something to think about. And that doesn't get influenced with any other disease states or anything like that. So again, there's ways about that, and of course, if you always want a second opinion, you're more than free and welcome to do that. It's actually highly encouraged because again, you cannot get rid of your von Willebrand diagnosis. It just doesn't go away. We need to be sure that it's accurately treated if anything were to happen. So you always want to ask questions. By asking questions, you seem more informed, you're getting more informed, and you're getting more educated. So for you listening to this presentation right now, you're actually doing yourself a service and you're advocating for yourself in a way because you're interested and you're curious to know. You want to understand your diagnosis. It's a long word, von Willebrand disease. A lot of time people mess it up. Even when I first started, I remember just having some issues because I kept adding an S at von Willebrand's. It's von Willebrand. But really understanding what your diagnosis is. What type do you have? What medications work for you? What medications you may need? And any time that you're traveling, that you get a letter from your HTC, your provider, so that you have that documentation with you. Anywhere you were to go, they can have that. For our pediatric patients, sometimes we'll include a letter directly to an HTC that may be around Disney World, for example, or Disneyland, just because those tend to be very common vacation spots, and hopefully once everything opens up, then you can actually talk to your HTC about doing that. Having a medical ID bracelet is very important. I know here at our center, we highly encourage everyone to have the medical ID bracelet. It has your diagnosis on there. And again, I know people may not always want to wear it, but it's important to wear that in the case that anything were to happen and you're not able to speak for yourself, heaven forbid an accident, or you're knocked unconscious, or you fall down, that you have your ID bracelet on so they know what to do and know how to treat you. And again, like carrying an emergency info card in your wallet or in your car, because again, just having that information accessible to anyone that's trying to save you, and for first responders or anything like that, that helps them be able to give the hospitals a heads up of like, hey, this person has von Willebrand's, just be sure you're treating appropriately, and then they can get in touch with your provider and stuff like that too. So again, you've been told you don't have von Willebrand disease or no longer have it, so what now? It's, for some people, they're like, oh, I don't have to worry about that ever again. But again, your bleeding history is going to speak a lot about that. So if you are still having nosebleeds, or you tend to bleed a lot with scrapes or cuts or things like that, that again are not typical, but yet you were told you're normal, that's not necessarily the case. So again, you cannot get rid of your von Willebrand disease. There's different things that affect those levels. So it's important that you look at how you are presenting with your bleeding. So that will definitely tell a bigger story. So you want to advocate, advocate, advocate. Sometimes just speaking up does so much, because if you just take what you're given the information and don't seek anything about it, then at that point, you're actually not helping yourself out. You want to make sure that you get all the information, you get a copy of your labs, and again, getting a second opinion if you need it, going to an HTC where we're more dedicated and understanding of these type of bleeding disorders, because again, unfortunately, not all specialties understand what bleeding disorders really are. And they may not always feel comfortable or may not always know how to treat appropriately. So we're here to provide that kind of care and that bridge between your specialist and you, to make sure that we're treating you appropriately, and again, that everything you need is being taken care of. Because the last thing we want to see is any complications or any further injury or anything like that. seeing if they offer genetic testing. So if your provider can offer genetic testing, and again, depends on your insurance too, so that's always a question for your insurance company, depending on what kind of insurance you have, what your out-of-pocket cost would be. And genetic testing, unfortunately, is not always offered upfront because it tends to be a little bit on the pricier side. So if that's something that you can talk about, or if there's some kind of coverage for that, like I said, our center offers that genetic testing. And again, getting a second opinion. I can't stress that enough. I think a lot of people feel like they're either insulting their provider or, you know, it's showing some kind of disrespect. And I know, especially in the Latino culture, you don't ever question the doctor, and that's not necessarily the attitude to really have. This is your body, this is your health. If you feel like you're not getting heard or there's some other concern, then you need to find someone that's obviously going to cater to you and be able to help you be more comfortable with your diagnosis as well as treating you appropriately. So those are just really important things to kind of help you stand out and advocate for yourself, because, you know, providers, we're human too, we're not perfect, but we want to make sure that you are being taken care of and you are your own person to speak up for that, for your child, for your husband, for your wife, and things like that. So again, it's always important to just make sure you understand the story that you're going to tell, as well as the diagnosis, the medication, and everything that you need to be sure that you're going to be taken care of very well. And at that point, if there's any questions, we can leave that for the Q&A. And then my contact info. So again, if there's any questions or any concerns, even if you're from a different state or anything like that, I am more than happy to help you with anything that you may need. So that's my email. Go ahead, feel free to contact me. And again, if there's any questions or clarifications, I'd be more than happy to help answer those for you. And with that, again, I'd like to thank you, John, for having me here. NHF, thank you so much. Very happy to be here, and I hope I was able to give you guys some information, and I look forward to talking to you guys all.
Thank you so very much, Dr. Cortez. This was so informational and thorough, and I actually was jotting down notes here. You know, I learned something about the different blood types as well. So really interesting that you brought that up. So thank you so very much. And specifically about the advocacy component, I think that's something that people in our community are still struggling with, and not just the Latino community, but just the bleeding disorders community. And it's great to hear that from a doctor saying, you know, get a second opinion, stand up for yourself. Your bleeding history is your history, and it's something that you can use. So really, really do appreciate you taking the time and the energy to put this together and to be here with us on our first virtual conference. So if you can please remember to take a few minutes to fill out this easy session evaluation, emphasizing the word easy. You can please rate the session. And also, if you have any comments in terms of any types of new programming that you would like to see us do for the next conference for 2021, you know, we really do take this into consideration. And also, if you complete the evaluation, you'll also be entered into a $75 gift card. And who doesn't want a gift card? So just remember that it'll be a raffle, so please make sure you do that. But more importantly, it's going to give us an opportunity to plan ahead as we move forward for 2021. Also, just want to remind you all that on August 8th, from 4:15 to 5 o'clock, we have VWD guidelines that are out. So we'll have Dr. Flood talking about that. And then also want to make sure that I invite you all on August 7th for our VWD networking from 4:30 to 5:30, where we have some live music. Once again, thank you so very much for attending our session. Thank you, Dr. Cortez, for taking time out of your day and sharing your expertise with us. Have a beautiful day.